Why is spinal manipulation the most powerful tool when it comes to chiropractic care? Why is it used so often and by nearly every single one of us? It works. It works well. It works fast. It's efficient. It's safe. And it gets to the root cause of a lot of people's problems. So today's blog is not going to go over why we should all be using spinal manipulation. You already do. It's great. However, there are three things that commonly come up, whether it's in conversation with other chiropractors or with my patient, that I'd like to discuss in a little bit more detail today. The first is what causes that pop. We're going to cover that pretty quickly. Number two is what are the benefits of spinal manipulation or joint manipulation. We should be a little more general. And then three, how do I, as a chiropractor, talk to a patient about what is joint manipulation? So first off, that pop. That pop is what most people want to know what happened. Now, not all joint manipulation results in a pop. There's a lot of different ways we can mobilize a manipulated joint. For today's conversation, we're going to go over HVLA, high velocity, low amplitude manipulation. When it comes to that, most of the therapeutic benefit is not the actual sound of the pop. In fact, when you look at the research, the pop doesn't matter all that much in long-term outcome. However, as someone who has experienced getting a pop and not getting a pop, that really doesn't matter as much to me as it does to the patient. And what we know is that patients want to hear that, especially in this kind of manipulation. So what is it? And the boiled down version is you're pulling two joint surfaces apart. Now, when you do that, you create more volume within that joint and you can create gas bubbles. Is that the cause of the pop? The research is showing probably not. It's actually the collapse of the pop when those joint surfaces come back on each other. So it could be a mixture of both. However, the take-home message is that we're taking joints and we're taking them within their anatomic limits, but within the active limit to the passive limit, and then a little past that in the paraphysiological space, meaning a range of motion the patient can't get into by themselves, at least actively. So when you hear a pop, what I can be sure of is that I've taken a joint all the way to where it wants to go, and then I take it out a little bit further, but never exceed the anatomic limit of that joint. If I would be in, there'd be a possibility of me straining or spraining or doing damage to that tissue. And what you and I know is that it doesn't happen. Now, when I can take a joint to its full range of motion, and I can go past it and I can hear that pop, I'm pretty sure that I have achieved full range of motion in that direction for that joint. So I can move on to the next thing that I'm going to tackle with that patient. So first benefit of manipulation is biomechanically. HVLA, without a doubt, restores joint mobility. It reduces adhesions, it improves lubrication, it improves fluid dynamics within the spine. It does an amazing job when it comes to the biomechanical benefits to that joint. Two, neurologically. It modulates pain through that gait control. If you bang your elbow on something and you rub it really quick, you're taking and stimulating those A delta fibers and you can shut off those C fibers. It also can relax tight muscles. It can recalibrate proprioception through Golgi tendon. So a lot of different things can happen neurologically as you take a joint and you take it through HVLA manipulation. It also can trigger neurochemical changes, reducing inflammation and releasing enkephalin. So a lot of things can happen chemically in response to mechanical treatment. So a lot of cool things. Number four, vascular. This is one of the biggest ones in my opinion, is because we are actually going to have increased blood flow and, depending on where you manipulate, increased cerebrospinal fluid circulation that can support tissue healing. So another cool thing about manipulation I don't often talk about, it is a little bit more tough to explain to a patient and to prove in literature, but we're seeing a lot of great research in the last several years about the anti-inflammatory properties of manipulation. And then let's not forget about the psychosocial, the psychological impact of spinal manipulation. It does reduce a little bit of fear avoidant behavior. And let me explain that. Have you ever had a patient, you're working with a neck, they can hardly turn their neck to the left, and then you're going to lay a patient down that you met 5 minutes ago, and you say, well, I'm going to take your neck to that point that hurts, and then I'm going to go a little further. Like, I can't do that. That hurts. That's not going to be possible. And then, of course, you can do that, and you can take a joint that they can't actively turn, more than 15, 20 degrees in left and right rotation, and you go through some manipulation, mobilization, and now they can have that. So you're boosting their confidence in movement. You're teaching the patient they can go through those things. So I think that in light of those 5 things that I talked about, when it comes to non-surgical, non-pharmacological care, manipulation is a top contender. It can give you that pain relief. It can give you that functional improvement. It can decrease inflammation and improve the psychological aspect of that pain syndrome. All things we need to take in consideration with manipulation. But how can I talk to a patient about those things? It's difficult. And do I go through that with every 8-year-old patient coming in for shin splints, every 35-year-old patient with cervicogenic headaches, or every 80-year-old patient with stenosis? No, we have to, I don't want to say dumb it down, but we have to appease the audience on what we're about to do. And what I tell my patients is that joint manipulation is really about just restoring motion. And I know there's more to it. And if that patient is interested, I'll get more into that. But in my practice, what I tell a patient is that, listen, mobilization and manipulation improve joint function. My job is to get things moving. I'm going to do that through manipulation, mobilization, maybe some modalities, maybe some tools I have in my office. Your job is to keep things moving. And if I can get things moving and get joints moving to the full range of motion, and you can keep joints moving, we know we're not stressing that surrounding tissue, we're going to allow tissue to heal. And if I don't do my job, or you don't do your job, unfortunately that tissue is not going to heal to its fullest potential, and it's going to either take longer to heal or it's just not going to heal. Now, there's a lot of times people ask me, how often do I see a patient with using joint manipulation? I have no idea. The question is what tissue is injured? If it's a muscle problem, give me 3 to 5 days. I'm going to get it loose. They're going to keep it loose, and we're going to let that tissue heal. If it's a ligament or a tendon, depending on how severe it is, 2 weeks to maybe 6 weeks. If they have a broken bone, not that I'm a true with manipulation, but every patient understands that bones take between 6 and 8 weeks to heal. The same principle applies to every tissue that we have in your body. If you're using the proper orthopedic testing, we should be able to guess or give the patient an accurate prognosis of how long it's going to take. So I'll say that this is that joint manipulation, as far as acute care, it just works wonders. It's safe, it's easy, it's effective for the 5 reasons I brought up before. There also is a separate component to joint manipulation I don't often talk about with this crowd, the chiro crowd that's so interested in getting people out of pain quickly. However, there is a huge need for routine joint manipulation. Now, I think that, or I hope that a lot of my patients would be able to get joints moving, keep joints moving, and I never have to see them again. However, there's 2 populations that I have to keep on seeing. One is the population that doesn't follow their directions. They don't do their joint mobilization. They sit in a chair for 8 hours a day and they never get up, and they blame me or they blame their spine or their grandfather because he had neck pain. And they say, well, it's just genetic. Well, that population, I just tell them, hey, in 4 weeks, come on back, bring coffee and donuts, and we'll just do this every month to keep you loose. I'm not a huge fan of that population, but I fill a void for them, and I provide that service with maintenance care. There's also another population that evidence does support that I think that is underserved, which is the population who is going through a level of joint degeneration that requires joint manipulation to prevent that from getting worse. We know that one of the biggest causes of degeneration is joint immobility. Let's provide that mobility. So we can do this for people with the degenerative process to hopefully decrease the amount of symptoms they're having. I think that's something that we can all do and get better at. So I hope this blog helps you. 1, what does joint manipulation do, especially HVLA manipulation? We're pulling joints apart. 2, the 5 benefits that we see with joint manipulation. And then 3, tailoring your response to what joint manipulation is for your patients. I want to bring up one last thing, is that I really like dynamic disc designs. I know it sounds like an infomercial. I have no affiliation with dynamic disc designs, but I use that one model, I know there's a bunch of them, that shows joint manipulation. It has a little suction cup at the bottom of the facet joint, and when you pull it apart quickly, it pops. Because for my patients that are having difficulty understanding that process, and you can show them, not tell them, what joint manipulation does and how when you pull those joints apart, it pops, it really does ease that first visit or that first manipulation that you provide to that patient. So something to consider, not only being a great teacher of what joint manipulation is, but also being able to visually show the patient what that is. So hope this blog helps. If you want to dive deeper into this information and go through all the references that's in this blog, and also obviously everything is in the condition reference section within ChiroUp. Thanks for listening.